Hey, doctor. Today I want to talk about new patient exams. One thing that's really important when we're doing new patient exams is that we're doing comprehensive exams, right? So this obviously it's the entire mouth, it's ortho, it's wisdom teeth, implants, the whole 9 yards. And what I found is this: if we just bring a doctor into the organization and we don't talk to them about this and we just send them loose, we find that somewhere between usually I would say maybe 20 to 50% of the examinations that they do on new patients are limited exams, right? They're limited exams. So when I first started seeing this, I would sit down with the doctor and talk with them, like, why are you doing a limited exam rather than a comprehensive exam? What was going on there? And they would tell me things like the patient only wanted a limited exam, or something like the patient was in pain, and so we only did the limited exam. We'll do the comprehensive exam next time. And so what I want to talk about is one, why we do comprehensive exams, and then kind of the scenarios under which we might not do comprehensive exam. So the reason why we want to do a comprehensive exam, there's two reasons. The first is for the patient, and the second is for the provider and the business, right? So for the provider and business, obviously, if we're doing comprehensive exams, we're going to find more work. We're going to end up doing more work. And that's just the reality of the situation. The difference in timing between a limited exam and a comprehensive exam is very minimal, right? So it's a few extra minutes for you to do a comprehensive exam versus a limited exam, and everything else is the same. Appointing the patient, confirming the patient, sitting the patient down. I mean, all of those things is exactly the same, whether you're doing a limited exam or a comprehensive exam. So the comprehensive exam, what does it cost us? It costs us like 4 minutes of doctor time, which is pretty inexpensive for the return that we get for the company and for the provider in additional work. But for the patient as well, when patients come in to do limited exams, and I know this because for many years I was on the other end of this as a treatment coordinator, so I would see the patients as they left and then as they came back for future visits. And what a lot of times happens is the patient is sitting in the chair and the doctor's doing an exam, and the patient has no idea about limited exam. They don't know any of these things. They just know the doctor's looking at my mouth, right? And then if the doctor's doing a limited exam, he'll go, "Oh, you're having pain there. We're going to you need a root canal. We're going to take care of that tooth." Great. It's $2,000. And the patient goes, "Okay, fine. Let's get this done." Doctor does the work. Patient comes back, gets the crown seat on a couple weeks later, and then the doctor does a comprehensive exam. The patient doesn't really know what's going on. They're just sitting there watching the movie, and they get the crown done, and the doctor does his thing. And then suddenly, somebody from me or somebody from the front comes into the back and goes, "But this is everything else that the doctor has found. It's $8,600." And several times I've had patients go, "What the heck? I thought I needed this. I thought it was $2,000 to get this fixed." And then I have to explain, well, that was just for the one tooth, right? So then, but you have other problems going on in your mouth. And the patient's like, "Well, wait a minute. I came in, I got an exam. I wish I knew this up front, right? I wish I knew it was $10,000 up front. I would have done things differently." Blah, blah. And we have to get in this big discussion, and I have to explain things to the patient. I have to apologize to them, and they start thinking, "What are these crooks thinking? Every time I show up, they're going to find another 5 grand worth of work." They don't understand that we focused on one tooth or one section at the first appointment, and then we're going to do something different at a later. They don't understand that. They start thinking, "Wait a minute. Every time I walk into this place, they're presenting me with another few $1,000s worth of work that they found magically because, I don't know, they need the money." That's what the patient's thinking. And so from a patient perspective, super important that we're doing these comprehensive exams and we make them comprehensive and we present them to them so that they can then make the decision about, "Hey, I want to get it all done. Hey, I understand what I need to have done, but I want to focus on this one tooth or this one quadrant or this half of the mouth," or whatever it is that the patient wants to do. That's their decision, but it's our responsibility to present that to them. The third thing is, legally and from a liability perspective, it is way better to do a comprehensive exam and to let the patient know these are all the things that you need to have done. Because then if if the patient's in the middle of treatment with you and something else happens, and then it comes back that, "Hey, we had a doctor do an examination of your mouth, and then a week and a half later, some other tooth blew up. They didn't say anything about that tooth." You then have, the patient's going to start thinking, "Well, wait a minute. He should have seen that, right? And why didn't he see that? What happened there?" The patient's going to start thinking this. They might reach out to a friend. "Oh, sue him," right? And then suddenly we have this whole thing, and then we have to explain, "Well, we were doing a limited exam, and well, it was coded as a comprehensive exam, and you should have. It was in the same quadrant. You should." Huge mess. Turns into this huge mess that we then have to unravel, and we end up doing work for free for ungrateful patients and all these things that could have been avoided if we had just done the comprehensive exam up front. So what I would say is 100% of the time, rounding to 100% of the time, when a new patient comes into into the building and you're going to do an exam on them, do a comprehensive exam and include everything from the wisdom teeth to ortho, implants, whether you do the service, whether you are able to provide the service or not, include it in your treatment plan. Get it in there. How do we do this? Or, tips and tricks on this. When we're doing the new patient interview, we tell them we're going to be doing an exam of your entire mouth. We tell them that. But when we bring the patient back, it's really important that the doctor does not screw this up by asking the patient, do you want me to do a comprehensive exam, right? Because if the patient's having pain here, and then you say, hey, do you want me to just look at that tooth or do you want me to look at your entire mouth? The patient, most of the time, is going to say, just look at this tooth because it's hurting me. And now you've gone from a comprehensive exam to a limited exam, and you've removed all of these opportunities that we might have with the patient and created all these problems. Patients in pain, they're in a dental office, they're nervous, they're scared. They're not going to remember the fact that you asked them whether you wanted to do the comprehensive exam or just. The patient will not remember this. High stress situation, their brain's not in let me remember everything that's going on mode. It's in like fight or flight mode, right? Making quick decisions. And so don't ask the patient, do you want me to do a limited exam or a comprehensive exam? Just go in and do the comprehensive exam. If a patient does not want a comprehensive exam done, they will have told the front office during the new patient interview when the treatment coordinator says, hey, we're going to do an exam of your entire mouth. If the patient doesn't want that done right there, because it's happened to me, right? They'll tell me right there, no, I just want the one tooth looked at. And then I can have a conversation with them about like, well, why? Basically, that's the conversation I'll have. And if that happens, for example, they might say, oh, I have another dentist. It's just, he's closed on Saturday. I'm here to get this one tooth looked at because it's killing me. Fantastic, fine. I will then relay that information to the doctor. So if the front office has not relayed information to you saying this is a limited exam, you are to go in with the assumption that you are to do a comprehensive exam. Do not ask, just go ahead and do it. Go in and do the comprehensive exam. But asking the question is really the thing to avoid in order to increase the number of comprehensive exams that you do. So talking about, I said round up to 100% for new patients getting comprehensive exams. Let's talk about what those few exceptions might be. And these are very, very rare. So rare that I probably shouldn't even bring them up, but I'm going to, just for completeness of this. The first one is extreme swelling. Not a little bit of swelling. I mean, even like if the guy looks like he's got half a golf ball in his mouth, that's not extreme swelling. Extreme swelling is like when they walk in the door and everybody in the building is like, holy smokes, right? It's like a half a tennis ball. It's distended to the point where, you're like, holy smokes, we might need to get to the ER because that's not good, right? So half a golf ball, not an excuse not to do a comprehensive exam. Half a tennis ball, okay, we get this, right? They need to be on some antibiotics. That swelling needs to come down before we can do any sort of comprehensive exam at all. Can't do any work on this patient. But they're very, very rare, very rare. We see over 10,000 new patients a year, less than one a year, right? So for you, seeing new patients, I would say you might see one of these in your entire career, right? So if you're seeing, if we go through and you're doing limited exams on 3 a month and you're like, the swelling's really bad, no, that's you're misdiagnosing the amount of swelling required to push the patient out the door with antibiotics. The second one is specialty, and this is specialty that was referred to us by another GP. So there's GPs in the area that maybe they don't do implants, right? So that GP sends his or her patient to us to place an implant. When a patient is referred to us by another GP, we do not steal that patient. We do not make any attempt to steal that patient. That patient must go back to the referring dentist. And so if that patient was referred to us to do endo or to do wisdom teeth or to do whatever the service might be, we only do that service. That's the only service that we will provide for that patient. So there's no need to do a comprehensive exam. But again, these days, most of that is being done by the specialists themselves, right? So many of these are HMO patients. They're being referred to our specialists. They'll be doing the wisdom teeth extractions or the ortho or those kind of things. But in cases where a patient comes in the door, they already have another GP doctor that has referred them to us to do one specific service, limited exam for those patients. Again, this is something that you're going to see once in a blue moon. But every other patient, again, 99.9% of all of your new patients, so rounding to 100% of all your new patients, should be getting a comprehensive exam every single time. Thank you.